Welcome. This is a video to introduce the Choosing Wisely campaign for family doctors in the United States. As most of you already know, the U.S. spends more money on healthcare than any other country in the world, yet ranks last in health outcomes when compared to other similar countries. 4 major themes were proposed to improve our healthcare system, called the Quadruple Aim. Number 1, to improve the quality of care for patients. 2, decrease costs. 3, improve the patient experience. And number 4, improve the experience for the provider. In an effort to decrease costs and improve quality of care, the Choosing Wisely campaign was established, and they have been busy, including many partners, both domestic and international, creating hundreds of publications and materials for physicians and patients to better discuss unnecessary medical interventions. For family doctors, the campaign suggests 15 specific interventions. Number 1, don't do imaging for low back pain within the first 6 weeks unless red flags are present. 2, don't routinely prescribe antibiotics for acute mild to moderate sinusitis unless symptoms last for 7 or more days, or symptoms worsen after initial clinical improvement. 3, don't use dual energy X-ray absorption or DEXA screening for osteoporosis in women younger than 65 or men younger than 70. 4, don't order annual electrocardiograms or any other cardiac screening for low-risk patients without symptoms. 5, don't perform pap smears on women younger than 21 or who have had a hysterectomy for non-cancer disease. 6, don't schedule elective non-medically indicated inductions of labor or cesarean deliveries before 39 weeks and 0 days gestational age. 7, avoid elective non-medically indicated inductions of labor between 39 and 41 weeks unless the cervix is deemed favorable. 8, don't screen for carotid artery stenosis in asymptomatic adult patients. 9, don't screen women older than 65 years of age for cervical cancer who have had adequate prior screening and are not otherwise at high risk for cervical cancer. 10, don't screen women younger than 30 years of age for cervical cancer with HPV testing alone or in combination with cytology. This recommendation is under review. 11, don't prescribe antibiotics for otitis media in children aged 2 to 12 years with non-severe symptoms where the observation option is reasonable. 12, don't perform voiding cystourethograms or VCUGs in first febrile urinary tract infections in children aged 2 to 24 months. 13, don't routinely screen for prostate cancer using a PSA or digital rectal exam. 14, don't screen adolescents for scoliosis. 15, don't require a pelvic exam or any other physical exam to prescribe oral contraceptive medications. The great thing about this website and their recommendations are that they come with supporting data and even patient handouts that can help you have an educated conversation. The reason these recommendations exist is that doctors have been ordering these interventions and patients have come to expect them. Of course, I would recommend using this site in conjunction with the EPSS or Electronic Preventative Services Selector, and another fantastic resource, the NNT.com, which gives clear evidence-based evaluations of risk versus benefits of specific tests and therapies. This is the Black Bag. Thank you for watching. Now go save our health system some money and improve care for your patients at the same time.